Well, hello everyone, and welcome to a Wellness Wednesday. So today the topic is patient advocacy, and this is the last session in the series Healthcare Navigation 101. And I like to start each week at Wellness Wednesday just by, of course, introducing myself. I'm Dr. Kelly Clark. I'm a doctor of physical therapy, and I am also the founder and main only physical therapist over here at Patient PT in Bloomington, Indiana. And I like to do these Wellness Wednesday lectures because I'm really I'm really passionate about health literacy and helping patients get the most out of their healthcare dollars. And so this series in particular, I feel is needed and important in today's really difficult to sort of navigate healthcare environment. There's a lot of complexity in our healthcare system today, and earlier lectures in this Healthcare Navigation 101 series have talked a little bit about who the different specialists in healthcare are, who the ancillary healthcare professions are comprised of, and who you should consider seeing for different types of problems. And, of course, the sort of main point in the Who's Who lecture is that you may be able to see a physical therapist like me for more things than you think. Physical therapists specialize in all sorts of things from vertigo to pelvic floor therapy to persistent pain, which happens to be my specialty. And I was asked recently if there's a difference between persistent pain and chronic pain, and the short answer to that question is no. Persistent pain is just kind of a newer term that is used in the research on persistent pain conditions, and essentially it's one of those things where they changed the term that people were using for it to cast it in a slightly different light. There was a feeling that chronic implied that that pain was never going to go away. So anyway, I specialize in persistent pain, but that can be in any number of different regions of your body. And I think that one of the things that healthcare today is especially having trouble diagnosing is those sorts of persistent pain conditions that are not easy to pin down because they may be related to weakness in a specific area or something that the person is doing in their day-to-day life that isn't so easy to diagnose in one session with a physician or an orthopedist or someone like that who has perhaps a pretty limited period of time to talk to you. So today, sorry, got a little bit off track there. So that was the Who's Who lecture. The next lecture was called What is Health? And it was all about health literacy directly and how there's kind of a big disconnect between a lot of healthcare providers and their patients, and how sometimes things like terminology and just biases and different perceptions about certain groups of people can really influence the thinking in both directions, from patient towards provider and provider towards patient. And then the most recent Wellness Wednesday in this Healthcare Navigation 101 series dove a little bit into health insurance and what it is and is not supposed to do in our modern healthcare system. So that brings us to patient advocacy. So last week in the session about health insurance, I did a lot of talking about what health insurance is and is not intended to cover. And sort of the key takeaway of that session was that wellness is not really covered by health insurance. Okay, it's health insurance, it's medical insurance, but it's not really intended to be wellness insurance. So if you are dealing with one of these sort of difficult to diagnose conditions that can't necessarily be healed or sufficiently addressed with a medical intervention like a surgery eventually, or a pharmaceutical like a prescription drug, then perhaps that is something that you should look into from a wellness perspective as opposed to a medical perspective, because there are a lot of intermediate steps in the wellness world that folks are not necessarily aware of, including physicians, and they may not know to tell you that that shoulder that just never felt quite the same after your bike accident could potentially feel a lot better with just a few weeks of Graston technique or something like that. So that's where patient advocacy really comes into managing your wellness on a day-to-day basis. It is much more necessary than most people realize to advocate for yourself or for your loved ones when you are in almost any sort of medical or wellness oriented situation. The medical system is really more a industry than it ever has been, and there are a lot of folks both inside medicine and outside on the wellness periphery that are for-profit entities. And you know, you don't necessarily have to lie or make really misleading claims to give people the wrong sort of impression about what it takes to maintain wellness on a day-to-day basis. And I think that a lot of folks end up trying to get a problem solved and come away with the impression that the only way to address it is via a medical intervention. Like, for example, cholesterol lowering drugs like statins. So statins have been in the news somewhat because they had some long-term consequences that weren't totally understood when they first came onto the market. And that actually is the case with a lot of pharmaceutical and surgical interventions. You know, the human body has a very long memory. As a matter of fact, the human body's memory is essentially lifelong, especially for traumatizing incidents. And whether it is popular to refer to them as such or not, surgeries and pharmaceutical interventions are in some ways traumatizing for your body. They are altering the way that it functions on its own. And sometimes that's just needed, okay? Sometimes your body needs some help to eliminate a pathogen or calm down a pain or something like that. And ideally, those things are only going to be temporary, or they're going to be a replacement sort of therapy for something that your body would normally do on its own, like in the case of taking insulin injections when you have type 1 diabetes. Okay, obviously you can't just go without those, and that's an excellent medical intervention, one that needs to, at least according to all of our current science and our best practices, take place on an ongoing basis. But it also doesn't work nearly as well or nearly as predictably without very careful monitoring of your diet and how much exercise that you're getting, because your body keeps track of those things, even though it may not necessarily be encouraged in day-to-day life or easy in day-to-day life to keep track of your caloric intake and exactly how much exercise you're getting. That is going to have an overall impact on your blood sugar. And so that's why when it comes to diabetes 1 and type 2, you have to have a balance of a lot of different approaches. And I think that that's something that just gets lost over and over again. So when it comes to patient advocacy, the reason that it's necessary at the end of the day is just because medicine is an incredibly complex thing. The human body is an incredibly complex thing. And so when you think about how all of the different systems in your body are interacting with one another, and when things such as blood sugar and how recently you've actually had the same type of exercise that you do on a given day, and what your even level of education is about a certain disease or illness that you are fighting, or even just a pain that you're fighting, all of those things actually can have a very real effect on things like your heart rate, your blood pressure, your blood sugar. All of them work together. And so it sometimes takes a lot of different professionals with a lot of different kinds of education in order to holistically address a problem. And there aren't necessarily a lot of medical professionals that look at the body from a more holistic standpoint, or look at the body from the standpoint of what you can do on your own at home, using exercise, using food, and regulating what it is that you're putting into your body on a day-to-day basis. The things that you're even putting on your body, things like lotions and things with lots of fragrances in them. One of the things that has been covered a little bit in the news lately is maskne, okay, the acne that you get from wearing a mask all the time. And folks have, kind of been seeing appearance of a lot of acne kind of in this area of their face. And fortunately, I haven't had to deal with that in the times since we've all been sort of more encouraged to wear these masks, because I use a fragrance-free detergent and fragrance-free softener, fabric softener, for all of my laundry and all of my laundry here at the clinic. And that is what the more recent studies have been showing, that the vast majority of acne that folks are getting associated with mask wearing is actually because of these chemicals that would not ordinarily cause such an immediate or such a severe effect as acne or a noticeable rash on your face. But over time, and given a very sensitive area like your face, where there are more nerve endings and more pores and higher blood circulation than many other areas of your body, and also thinner skin, all of these things come together to make an environment that is a little bit more likely to react to something that would ordinarily have a very slow sort of cumulative effect, kind of like that compound interest that I've talked about in some of the other Wellness Wednesday sessions. So really, patient advocacy is necessary because there is a lot of specialization in the healthcare professions these days because of that high level of complexity. And most of the healthcare system, including and especially professional level healthcare folks like physicians, physical therapists, even like dentists, and everybody that's kind of at the doctorate level is under a lot of strain and may not think of all of the different things that you need to be referred to. And so if you have preferences about how your treatment is going to go and what sorts of interventions you are going to be using as part of your care, that's something that you really need to speak up about, probably more than you realize, especially if you have never had a lot of in-depth contact with the healthcare environments, or even just one healthcare environment. As you know, I've talked about in the who's who, just going from a hospital environment to an outpatient clinic environment, you're going to run into vastly different types of professionals with different perspectives on healthcare and different jobs. And that means that they aren't necessarily going to think that in addition to being sent to a physical therapist for rehabilitation on your knee surgery, you may also need to go to a physical therapist for rehabilitation after you have a surgery to remove a cancerous node in your armpit or something like that. But all of those things really do work together to bring you back to that sort of even keel of wellness that you need to be at in order to maintain lifelong health. And then, of course, that last lecture, I got a little into health insurance. And that's really one of the biggest reasons that patient advocacy and advocating for oneself and your family members is really important in today's healthcare environment, because health insurance, again, it's unfortunately one of those industries that is the most, I don't know, I guess effectively motivated by profit margins. One thing that you may or may not be aware of is since the COVID-19 pandemic began affecting life here in the United States, healthcare providers across all environments, whether it's outpatient, hospital, rehabilitation hospitals, skilled nursing facilities, those nursing homes out there, all of the healthcare environments and healthcare professionals have seen a pretty big hit to their bottom lines and their profit margins. And at the same time, all of the health insurance companies have really been thriving and making record profits, okay? And that is just one of these functions of, well, not functions, just sort of natural results of the high level of complexity, the high demand on various healthcare professionals. And it's one more layer of very compelling influence over people's healthcare, because of course health insurance companies in the United States do have the ability to refuse to cover various procedures. And when those things are not covered by health insurance, providers often are relying on those coverages for payment for their services. And, you know, payment in my mind really should not be a big influence in healthcare. I think a lot of people feel that way. It's not a unique thought, but unfortunately it does have an effect on providers, and they have to make sure that they're getting paid for things, because that's obviously a really slippery slope. So how do you advocate for yourself One of the most effective ways to advocate for yourself as a patient is really just by having a thorough understanding of your own history, okay? The things that have happened to your body, the influences that you have been exposed to throughout your healthcare life, your wellness life, are a huge part of what makes up the picture of who you are today. As I mentioned earlier, the human body has a lifelong memory. So if you had an accident, an injury, an illness at some point in your life, that may have some subtle ongoing effect on your health. That doesn't mean, obviously, that every time you have an injury or an illness that needs to affect you in a noticeable way for the rest of your life, but it may affect your overall health and wellness. It may affect your healthcare provider's ability to diagnose you. So, even though healthcare records are pretty difficult to transfer from provider to provider, that is starting to get a little bit easier with increased use of electronic medical records. But really, even just keeping a thorough log of various things that have happened to you on your own can be incredibly helpful. I've seen folks who keep kind of a timeline of various health events in their life, and especially after you've had a serious health event like a major surgery or a serious accident or a serious illness that left you debilitated or resulted in a hospital stay of more than a day or two. All of those things really need to be sort of in the forefront of your provider's mind a lot of times in order to really understand what's going on with you as a patient. You also really need to come into your healthcare appointments with a thorough understanding of what your goals are, okay? So one of the reasons that I became so interested in patient advocacy is because of what I and my family went through when my father was diagnosed with stage 4 lung cancer that ended up being terminal within about 5 months of his diagnosis. So there are, of course, a lot of medical dramas out there that that give the impression to a lot of folks that there are lots of resources being dedicated towards making sure every single person has an accurate diagnosis and they're being treated for it. And unfortunately, that is just not always the case. That's not always possible. And so a lot of times the limitations in your healthcare are really just the limitations of an individual provider. You may, and this is something that I've talked about in the past Wellness Wednesdays as well. It could be as simple as you are talking to a physical therapist and you need to be talking to a physician or vice versa. But it could be you are just talking to the wrong physician or the wrong physical therapist. We are all just human beings and we all end up putting together that really complex medical education in a different way at the end of the day. And our practice and the things that happen to us and to our patients throughout clinical practice have a big influence on how we end up treating folks as well. So the bottom line there is that you need to not be afraid to stand up for yourself as a patient and what you really want to accomplish with your therapy or with your visit to that physician or chiropractor or even a massage therapist. It is only helpful to come in with a clear idea of what it is that you wish to accomplish, because believe it or not, that can vary enormously from person to person, especially depending on where they are in their own lives. There are folks who come in with goals at Patient PT that are just things that seem almost sad as compared to my experience of life, because they will want to reduce their day-to-day pain from a 8 out of 10 to maybe a 4 or a 5 out of 10 every day. And in my world, on that pain scale, a 5 is pretty dang uncomfortable. That is, the kind of pain that you really can't ignore and is stopping you from doing a number of things. And if that's really irritable, which means like if that is prone to spiking up to a much higher level at various times, that can really stop you in your tracks. And so having a clear idea of what your goals are can be really important, because your provider may be thinking that your goals are to get that pain down to a 0. And that can influence their clinical decision making. They may assume that your goal is to get stronger and be able to do more things that you used to do, even if you have no interest really in doing any of those activities again. So you have to keep that in mind when you are talking to those healthcare professionals that may have limited time and attention to dedicate towards especially the history of your specific case. And it can be very easy as a healthcare provider to fall into the trap of just using general rules to sort of categorize what's going on with different patients. And that's how you end up in situations where you are in a big physical therapy gym and every person seems to be doing a variation of the same exercise program, or there is a new medicine on the market and it seems like half your friends are on it by the end of 6 months or something like that. Those traps really do happen in clinical thinking in the medical world. And so that's just one more reason that it's really important to be clear on your goals. And if you're going into your physician's office or your physical therapist's office or whoever's office to talk about your health and wellness, know what it is that you want from that. If you are looking for a drug-based intervention, that can be a tricky thing to pursue, especially if you're looking for pain medications, but that is a conversation that will benefit from some level of transparency and honesty about what is going on with you as a patient and what you hope to accomplish with this change to your medical care. If you would rather have an exercise and a wellness-based intervention, don't assume that your provider is just going to offer that to you. If you're looking for a prescription for physical therapy, ask for a prescription for physical therapy. And it seems presumptuous and kind of strange to a lot of folks to ask questions about specific drugs. But you always see those prescription drug commercials where they say, ask your doctor about whatever. And while that can be kind of a mixed bag in the medical world, and doctors and everyone have different feelings about folks who are, lay people as opposed to medical professionals having that sort of influence and opinion about their own care, that's the only way that you're going to ultimately get that across. It's important for your healthcare providers, more than almost anybody in your life, to have a clear idea of what's going on with you as a patient, because virtually every detail matters in today's healthcare world. It's just true, okay? So that's where I come to my next point on today's Wellness Wednesday outline, and that's honesty, okay? You shouldn't be afraid to say the hard things. And the hard things to say are different for everybody. Sometimes saying the hard things means being honest about pain that you decided a long time ago you were never going to be able to get rid of, or a habit that you have decided you're not going to be able to break. Some folks, for example, don't like to admit to healthcare providers when they smoke or when they have addictions, or when they've been using painkillers for a really long period of time, even if they're over-the-counter painkillers. There are all sorts of things that you may feel inclined to sort of leave out when you're talking to your medical providers, but at least from my perspective as a physical therapist, virtually all of those things end up being really helpful when I am trying to figure out what to best do in order to help a patient reach their goals. So don't be afraid to be honest with your healthcare providers. And if for whatever reason you don't feel comfortable being honest with your healthcare providers about what your goals are, especially, and why you are there seeking that medical care, then that is the time to be honest with yourself about whether or not you're actually happy with your medical care or your health care or your wellness care. It can be difficult when you have a face-to-face relationship with somebody who's helped you in any way to realize, or to let yourself know, or especially to let them know, that this is a relationship that is no longer benefiting everyone in it. And it's really okay. Unfortunately, we are all consumers in the healthcare world these days. And so if you're not getting what you need to get out of your healthcare, don't be afraid to start seeking out a new provider, because that's really sometimes the only way that you're going to get a better result. And then the last point in self-advocacy that I wanted to touch on was taking advantage of some of the few flexibility points in the system, which is one of the most prominent ones that comes to mind is health savings accounts. Because with health savings accounts, there is a lot of leeway as far as what that money is spent on. It can be a way to go and see an out-of-network provider or a provider like myself who does not bill insurance directly and can only provide invoices for reimbursement. But those health savings accounts are really intended to give you a little bit more flexibility and at a minimum cover those deductibles. And so that's one more thing to think about when you are looking at trying to improve your results in healthcare. Okay, if you wanted to see a private practitioner like myself and they are out of network for you or they don't bill insurance, HSAs and deductibles are often something that will apply to that, whereas your regular healthcare dollars wouldn't necessarily. So if nothing else, if you can afford to pay out of pocket for something like a out-of-network provider or someone like me who accepts payment up front and sort of will work with you on the number of visits that you see, that can be a good way to get those high deductibles paid off. It's money that you're going to have to pay anyway, and then maybe later in the year, if there's other things that you need to do, those can be covered by your medical insurance, and not have to go, towards a $2,000 or a $5,000 deductible all at once. And then the last thing I wanted to talk about was whether or not someone else can be your patient advocate. And this is something that is incredibly important. When you do not have somebody else to be your patient advocate, it can be extremely difficult as a patient to advocate for yourselves. And I think that that's something that a lot of people don't necessarily realize until they find themselves in kind of a scary healthcare situation. Of course, those things can totally hit you out of the blue. And this is one of those things where a lot of medical research gets confusing for folks. So there's a lot of talk about how folks who are married have longer lifespans, or folks who have children have longer lifespans. And those things are true from a statistical standpoint. But when it's difficult to describe exactly why really complicated phenomena like that happen, it can be very easy to get trapped into thinking things like it's just random, or it's morally superior is actually what happens with a lot of that sort of medical research. Having a family, having close friends, having a church community to rely on for support when you are going through a medical crisis is really, I think, one of the main reasons that those sorts of outcomes are different from folks who are not so close to others, don't have immediate family members, don't have spouses to rely on. Because when you are by yourself, it can be really difficult just to do very simple things like getting yourself to medical appointments or arguing with the insurance companies when you need to. And if, God forbid, you find yourself in a situation like my poor father was in, where you have a really late stage cancer diagnosis or something else that is extremely scary, one of these nightmare scenarios, it's very difficult to really think straight in those situations and not get overwhelmed with just like the first scary word or phrase that comes out in that conversation and just forget all of the things that you intended. So, especially if you don't have a relatively organized and calm influence in your life, whether that's a friend or a family member or a spouse, at least do yourself the favor of making a list of things that you want to talk to your healthcare provider about before you go in there. Preparation is absolutely key when dealing with these complex services. And so, even if it's just a few things that you jot down when you're by yourself in the morning before you go to that appointment, it can make all the difference in coming away from a healthcare encounter with a positive versus a negative outcome, especially just from your own perspective. So, let's see. Oh, and of course, another thing I wanted to touch on with regard to someone else being your patient advocate, there are professionals and agencies who can advocate for you from a really knowledgeable standpoint, okay? So Here in Bloomington, we have the Area 10 Agency on Aging, for example, that can really help provide a lot of important healthcare navigation services, help you get connected with the right kind of professional, help you interpret some of the things that are going on in your medical world. When you're in hospitals, a lot of times there are social workers or nurses who are working in a healthcare navigation sort of role, and it can be their job to help you move on to whatever your next destination is smoothly. And so don't be afraid to inquire. If you're feeling really lost in your healthcare or wellness journey, do not be afraid to ask the quote unquote dumb questions, okay? If you have no idea where to go next, if you don't know what you're supposed to do next, then don't be afraid to ask those questions and see if there is more help there than may meet the eye. Because a lot of times you may have to ask more than once. You may have to stick up for yourself a little bit more vocally than you're usually comfortable with in your day-to-day life. But it can really be worth it. It can be the difference between being really happy with your visit and coming away with the kind of solution that you were looking for, and just sort of walking away dissatisfied and just as confused as you were before about what's going on. So I think that that's really all that I wanted to say about patient advocacy today. The next Wellness Wednesday, I think I'm just going to be watching my inbox for some questions. So if you want to send me a message on Facebook or via email, patientphysicaltherapy@gmail.com. If you have a question about any of the things that I've been talking about during Healthcare Navigation 101, those are welcome. If you just have regular questions that you'd like me to talk about next week on Wellness Wednesday, it will be September 9th, and I will be right here at 12:30 again to take any of those questions. And failing that, I think that I might end up just doing a little bit of a short talk on things that you can do to maintain your hands and your grip strength when you have hobbies like sewing. A lot of you may be aware that my side project for the last several months during the pandemic has been Bloomington Mask Drive. And I have encountered a lot of folks who sew, and not just masks, they sew all kinds of things. It's like their favorite thing in the world to do. And I have gotten familiar with some of the common aches and pains associated with that, and what I've got some tips stored up that I'd like to share with y'all. So if I don't get enough questions to keep myself busy next week, that's probably what I'm going to be talking about. But hey, I want to hear from you. If you have feedback for me about what time of day I'm doing this, what sorts of things that I'm talking about, how I should get it posted on social media. If you just want to tell me that you like my jewelry, which by the way, this was handmade by a local artisan, Jennifer Payne. Her website is, I believe, poesispayne.com, but you can definitely find her under Poesis Payne on Facebook if you like this sort of thing. It's hand wire wrapped and I love it. So yeah, even if that's the kind of question you have, you want to tell me where, that you like my outfit, I'm always in need of a boost in these pandemic times. So send me a message, patientphysicaltherapy@gmail.com, visit my website, patientphysicaltherapy.com, or send me a message right here on Facebook. And I will see you next week for Wellness Wednesday, if not before.